Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is my March CEO Connection. And I'm really pleased today to have Dr. Andy Davidson be my guest, and we're just going to talk a little bit about his practice here in north central Arkansas and some of the things he's been through over these past several years. When I came to Batesville some 26 years ago, Dr. Davidson was one of the first people I'd met, and he'd been here quite a while prior to that. So he actually worked at the Cave City Clinic at that time, and I remember going to Cave City, and we got off to a great start in terms of a relationship that's lasted for 26 years. He's been an outstanding member of the medical staff. I believe one of the guys who can see the future, visionary, and has participated in helping us prepare ourselves to better meet the challenges of healthcare. And so I'm really pleased, Doc, that not only have you been on the medical staff all these years, but thanks for coming today. Tell me a little bit about your past, and you practiced at Cave City and then came to Batesville and back to Cave City. Right. Why don't you talk a little bit about your interest?
I was raised up in northeast Arkansas in a rural area, so I've always been real interested in rural medicine. And whenever I originally came here, the old Gray's Hospital was open, and that's where I practiced at. And Dr. Rainey, who was an older doctor at Cave City, had practiced there for years, and he talked to me and asked me if I would come and work a couple of days a week at Cave City so that he could take some days off, and so I started doing that. And the other thing we did while we were at Gray's, actually, Dr. Lambert and Dr. Smith, Terry Smith and I built a clinic in Melbourne and hired a doctor there to go there and help them with their medical care there. And eventually I sold my part of that to Fran Duke, who practiced there for years. And so I've always kind of been interested in the smaller towns because that's where I grew up. Those were people that were like my family members, and those are the people that I like taking care of, and so I like it being in the rural areas. And then I was at Cave City, and then you came to White River, and I remember that you came and visited me at Cave City, and at that time you were interested in the rural health clinic program. And so you talked to me and said you were interested in putting some clinics in some of the smaller towns so that they would have access to medical care, and would I be interested in working with those clinics and help doing that? And I said, yeah, I would. And actually, I think we together did 4 or 5 clinics then. Newark, Pleasant Plains. I remember going to Pleasant Plains looking for a place for us to put a clinic. Basically, White River put it in, but I helped work there. And then also at Cherokee Village and Melbourne and Newark, I think.
Were you involved in the Drasco Clinic when we opened there?
No, not really.
No.
I was kind of distant on that one, but anyhow, I worked with the nurse practitioners who were in each of those clinics, and continued to work at Cave City.
So you weren't involved in the Strawberry Clinic, though?
Yeah. Right.
Well, I thought you might be because of the proximity from Cave City.
And then as we got more and more medical providers there, then I was more able to stay there at Cave City. And so then I pretty well stayed with Cave City up until, I'd say, it was about 12 years, and then there were some concerns about whether the hospital was going to keep the rural health program or not, and so I talked with Dr. Waldrop and Baker and about going into their clinic there, and so I did that and was there probably about 12 years. Yeah. And then, as medicine's gotten more complex, not medicine as much as the business side of medicine's gotten more complex, there's more regulations, electronic medical records, HIPAA, things like that are more difficult to really manage and run a practice. We began talking with the hospital about the possibility of selling our clinic to the hospital, and then hopefully being able to concentrate more on just actual medical care and not as much on the business side of things. And so during that process, Robert contacted me and said, hey, is there any way you'd be interested in going?
Robert Wright.
Robert Wright,
yeah. Okay, yeah.
Contacted me and said, is there any way that you'd be interested in going to Cave City? And I said, yeah, I'd love to. And
going back home?
Yeah. And so that worked out, and I'm back at Cave City, and I love it. I missed being there. A lot of my patients still came to Batesville, and it really is a kind of a going home sensation because that's where I originally practiced, and really have more memories of practicing at Cave City than I do at Grace Hospital. And you know, I have patients from Batesville that I've really grown close to, and so I you know, that was kind of a mixed emotion, much like whenever I moved from Cave City to Batesville. But some of those still travel to Cave City, and hopefully as that road gets improved, then that'll be an easier task to do. But yeah, I'm really enjoying it. It's been a little difficult because we do the new computer system. We had to transfer, and that's always difficult to transfer to a new system. And then I ended up breaking my arm and having to have surgery, so that kind of slowed things down a little. But now then I think things are back on the upswing, and I'm really enjoying it.
Now, so you're at Cave City, and Kay Plumley practices up there, doesn't she?
Yeah.
So if a person wanted to have an appointment, they just call the office there and schedule it that way, and you guys probably have time to work in most people, particularly this time of the year when it's got a lot of flu and stuff going on. So. And
it's been better to be able to work them in now. Again, whenever I had my situation going on, we couldn't see as many or sometimes, but it is getting better on that. So
I know you had quite a fall that broke your arm.
Yeah, it was a fall that kind of Dr. Carpenter fixed me up, so I'm doing better.
Well, we're pleased to have Dr. Carpenter.
Yeah, we are.
For sure.
Yeah, he was real helpful.
But you know, over the years too, Doc, you've always been really interested in population health type stuff, and whether it's on the Accountable Care Act, or I know you've attended a lot of the conferences with me over the years and tried to stay on top of it. How do you see that's going to work in the future in terms of how you're going to practice medicine? Because, you know, when I came here, you not only had a clinic, you used to come to the hospital every day and saw patients that had been admitted. And of course,
saw nursing home patients. Saw ER patients. And, we did it all. Yeah.
And so now that season basically has gone away, hasn't it? And so how do you see things going now in the future for you?
Well, I do think that the population health is going to, regardless of how healthcare is affected by President Trump's changes that may occur, that's kind of a ship that's already sailed in insurance companies. And I work with the ACO here, work on the quality committee, and we help develop medical problems that we monitor, and that we keep tabs on myself and the other doctors, and let all the doctors and myself know how we're doing on basic things like mammogram, diabetes care, things like that in preparation for that. And the hospital's really involved in that. They help get our information together along with Blue Cross Blue Shield, and they share on that committee to help all the clinics to hopefully develop a greater quality of care. And of course, as Medicare goes on, a greater percentage of what you're going to be paid is going to be related to your actual quality of care and measurements that they will do. Right now, it's really pretty burdensome because I think that it's a new thing with computers. There's a lot of little buttons that you have to click and keep up with. And I think as time goes on, we'll be able to better refine actually what we monitor on patients that make a difference in the future, and there won't be so much just small things that are kept up with. But it definitely is going to make a difference in how doctors are reimbursed in the future, but I think also in a positive way. As things get more refined, it'll help us to do a better job of taking care of our patients.
Yeah, the whole community. You know, it used to be in my training, I was always trained on taking care of patients once they came to the hospital, but my responsibilities ended when they left the hospital. And gosh, the way that things are going right now, that continuum of responsibility never ends right now as healthcare goes, and as what will be expected of us in the future. So,
we get notified by people from the hospital, you know, if someone has had repetitive readmissions or may be more likely to be readmitted. And then that helps the clinics to better be able to take care of those patients or concentrate on those patients. in Batesville Family Practice, when we were there, we were involved in a program, you know, to monitor emergency room visits, and those patients who seem to go to the emergency room a lot, we would try to contact them to help prevent that. And I think that's kind of the whole push of all medicine.
Well, it's really better care when patients are seen by a doctor on a routine basis rather than episodically through the emergency room, and that just makes a lot more sense.
Right.
Well, I really appreciate you coming today and the leadership you provided us over the years, and I look forward to many, many more years of working with you, and so
Well,
thank you.
I appreciate the opportunity to be here, and I've always enjoyed my work with you, and look forward to that also.
Thanks for coming today. Appreciate it. I'm pleased to report that we have two excellent employees of the month this month. At Stone County Medical Center, Heather McClanahan, an RN, Assistant Director of Nursing, has been recognized for helping out in all the nursing areas and always coming in when needed. Heather has been an employee of White River Health System for 12 years, and about the last 2 in their current position at Stone County Medical Center. I've known Heather, and we're really blessed to have Heather on our staff, so be sure to congratulate her on her recognition. At White River Medical Center, Diane Horn from our materials management was recognized for demonstrating prompt service. Now, Diane has been at White River Medical Center for 36 years. Gosh, I've known her ever since I've been here, and it really kind of surprised me she hasn't been Employee of the Month previously, because she's such a great employee. So if you see Heather and Diane in this next month or so, be sure to congratulate them on their recognition. A couple of exciting things coming up here in the next month or so is first of all Blue and You Fitness Challenge, which will run from March 1st to May 31st. In the challenge, participants will log their daily activity online and receive points for their team. And if you're interested in joining our team, you need to go to www.blueandyoufitnesschallenge-ark.com, and so be sure to do that. I think it's just a great way for all of us to get more active and have a healthier lifestyle. In addition to the Blue and You Fitness Challenge, we're also going to start an employee engagement survey that will begin sometime in late March. The purpose of it is to just get feedback on a more formalized nature about just what we're doing well and what areas can we improve. One of the reasons we're going to use an outside service to assist us in this is we want to be sure the employees' comments and feedback are held with confidentiality. So I hope that everyone will participate in the employee engagement survey, because frankly, the benefit from the survey will be dependent upon how much feedback we get, and so please prioritize that near the end of March. On March 14th, we'll have our monthly community education event. Dr. Steve Alexander will be presenting a program on breast care. It's in the Josephine Ray Rogers Center for Women in Imaging. It'll start at noon, and lunch will be on us. So, Dr. Alexander has a real passion for developing our breast center of excellence, and I think if you come and listen to what he has to say, you'll catch on to that passion, and you'll understand just why it's so important to not only him and his conquests of career goals, but also why it's so important to us in our community. So come on over on March 14th and listen to Dr. Alexander's presentation. As our initiative to improve community health, the volunteers will conduct a Safe Sitters course on March 20th and 21st from 9 o'clock in the morning till 3:30 in the afternoon. The purpose of the program is to teach those young adults on what is safety in terms of when they're babysitting for other younger children, or actually for themselves as well. So the program will be at the WRMC Collier Annex Education Room. Lunch is provided, and if you know of any young adults in that grades 6 to 8, I encourage you to have them come and participate in the program. Over the last couple of months, we've been really actively involved in the preparation for our internal medicine residency program that will start in July of this year. In addition to receiving ACGME accreditation, we have been interviewing candidates to be part of our first class of 10 internal medicine residents. Interestingly, that we've had over 900 individuals who've shown an interest and applied for those 10 slots, and so our staff has really been involved in interviewing, having on-site visits, and finally putting together a list of those that we most would like to have join us in coming this summer. The program will actually culminate on March 17th when there will be a match of those that we'd like to have come here and those that want to come here. And so sometime by the middle of March or near the end of March, we should have a pretty good handle of who the first class of doctors will be trained here in internal medicine. I can't tell you how excited I am about this new program. We're really off to a great start. Kudos to Dr. Casati, Dr. Morgan Norton, and Jody Smotherman, along with Mary Wood-Cox, who have done a great job in getting this program up and running. So I'll give you more updates in the next few months as this becomes more materialized as we approach that July timeframe. So that concludes my CEO Connection today. If you have any suggestions on how I can do better in the future, how it might be more meaningful to you, be sure to let us know. So have a great month. Thanks.